was approached by several of the people from our emergency response team about helping them set up where the actual clinics would be. And my response was, well, I'm not here to set up the clinics, I'm here to volunteer as a physician. I drew on my experience from the military. I was a career military officer for over 20 years. And during my time in the military, at one time I was the 8th Air Force Mobile Hospital Commander. So I knew a little bit about setting up emergency hospital type units. Well, the response was incredible. In fact, the response was so incredible. I mean, it just made me feel proud to be part of the medical profession. We had physicians from all over the country wanting to volunteer. We had, of course, the vast majority of our UT physicians wanting to volunteer, who did volunteer and who did help. Nurses, and the nursing school here, the School of Public Health here. But we had nurses from all over the state, from all over the country wanting to volunteer. We had administrators to help us set up computers and keep track of patient records. We had non-medical personnel all over this community show up at the convention center asking to help. And it really did my heart good. One night when I was over there as a chief medical officer, my daughter showed up with two of her fellow workers after working all day, showed up and said, "Dad, I have to do something to help. Can I help?" So I put her to work signing in patients. But we had people like that from all over this city respond, from all over this state. We also had medical students from Tulane and from LSU, even though they'd lost everything there. And several of them had told me they'd lost their books and things. And I had them bring over a case of my textbook, Williams Obstetrics, and gave it to several of the students, because I felt so sorry for them that they lost everything, including their books. It was amazing. They were more worried about losing their books than they were their clothes and other things. And I can remember talking to the medical students and saying, this is one of the greatest experiences that you will get, because if you aren't touched by this, then you picked the wrong profession. And just seeing that made me feel like a physician again. It reminded me of why I went into medicine in the first place. And I know that sounds corny, but it's not corny. It's from my heart.